Putting yourself through a knee replacement, only to still have pain after you're apparently fully recovered, is one of the most frustrating things a patient can face. And when you're in pain, the last thing you want to hear is that everything looks fine. I'll be honest with you, there are several reasons why this can happen. But one thing that many people never consider is that knee pain can actually come not only from your knee, but from a completely different part of your body. I know it sounds bizarre at first. So in this video, I'm going to walk you through the not so obvious reasons a knee replacement can still hurt. That includes problems with the knee itself, and problems outside the knee that throw people off guard. If we haven't met before, I'm Dr. Bounajem. I'm a board-certified orthopedic surgeon, and I specialize in hip and knee replacements. I'm about to go through proven causes of knee pain after surgery, but just remember that this is meant to educate you, not diagnose you. Follow your surgeon's guidance rather than trying to diagnose yourself on YouTube. So, let's start by answering the big question. How do problems outside the knee joint cause pain in the knee? One of the most common ways this can happen is through referred pain. How referred pain works isn't completely understood yet, but one of the major theories is that it all comes down to how the nerves are wired. Pain signals from your hip, your lower back, and your knee all converge onto some of the same nerve cells in your spinal cord. Think of it like a switchboard where multiple phone lines feed into the same operator. When a pain signal comes in from the hip, for example, the brain can misinterpret it as knee pain, because those signals are sharing the same pathway. The pain is real, but the source isn't where you're feeling it. That's exactly why patients with hip problems like hip arthritis can actually feel the pain in their knee instead. Hip arthritis is common in patients with knee arthritis, and studies show that over half of patients with hip arthritis feel pain in their knee. It's hard to believe, but some of them feel it more in the knee than the hip itself. But the hip isn't the only suspect here. Your lumbar spine, which is your low back, can also send pain to the knee, and it can actually do this in two separate ways. The first is through that same referred pain mechanism. Some discs and joints in your low back share similar nerve pathways with the knee. That means problems in the low back can cause dull, aching pain that shows up in the knee instead. The second way is through something called radicular pain, which is a different problem altogether. This is when the nerves themselves get pinched or inflamed, which can send sharp, shooting pain to the leg. The lumbar spine levels that typically cause pain in the knee area are L3 and L4. Referred pain and radicular pain are similar in some ways, but they are different. Referred pain is where shared nerve pathways make it difficult for the brain to tell where the pain is coming from. Radicular pain is when the nerves themselves are inflamed or compressed. Now, these pain sources from the hip and the spine are among the most important to consider when trying to determine why a knee replacement is still painful. Here's the thing though. There can absolutely be problems within the knee itself that can make it hurt. In fact, there are several things that we surgeons look for in the knee replacement, and I'm going to share those with you now. The first problem is one that a lot of patients can relate to, and that is stiffness. One cause of stiffness is too much scar tissue forming in the knee after surgery. This is called arthrofibrosis, which comes from the Greek and Latin terms for joint and fiber. Arthrofibrosis is linked to high levels of inflammation in the knee, and that inflammation leads to pain. But inflammation isn't the whole story. The limited motion in the knee throws off the knee's normal biomechanics, and that leads to more stress on the joint. For example, if you can't straighten your knee effectively, your quadriceps muscles on the front of your thigh have to work extra hard to support your leg. That puts more strain on the front of your knee. And if you can't bend your knee, you have to stretch and fight against the scar tissue to do things like get up from a chair or climb stairs. Now, scar tissue plays a big role in pain, but the position of the implant is just as important. Let me show you how. When we perform a knee replacement, we position the implant as precisely as we can. If the alignment or rotation is off, it can affect how the kneecap tracks, how tight the tissues around the knee are, and ultimately how the knee feels overall. For example, the groove on the front of the femoral implant is where the patella or kneecap glides when you bend your knee. But if the femoral implant is put in with too much rotation, the groove moves away from the patella, and the tracking of the patella gets thrown off. That's exactly why we call it patellar maltracking. You can think of it like wheel alignment in your car. Just like how misalignment can cause stress and damage on your car's suspension, patellar tracking problems can cause stress and more pain at the front of your knee. Here's the thing though, the position of the implants affects much more than just the tracking of the patella. If the implant is positioned too far to one side of the bone, the prominent areas can inflame the soft tissues there and cause pain. That's why we typically keep the implant within the boundaries of the bone as much as possible. And if the implant is put in at an angle that doesn't put equal tension on the ligaments, the knee can give out frequently, which then causes inflammation and pain. When the knee is unstable, patients often feel like they just can't trust their knee. But it turns out that even if the implant is positioned perfectly, the knee can still be painful if the implant loosens over time. In fact, implant loosening is one of the most common mechanical causes of long-term knee replacement pain. During a knee replacement, there are two ways that we can attach the implant to the bone. One is with bone cement, which works similarly to the cement that most people are familiar with. The other is with press-fit implants. These are placed with a snug fit on the bone. And over time, the bone actually grows into the small pores on the surface of the implant. Both cemented and cementless knee replacements have good outcomes, but a small percentage of each kind can still loosen from the bone. When that happens, the motion between the implant and the bone causes inflammation and pain. Patients often notice this pain when first getting up and starting to move, but some patients just feel pain with physical activity in general. These mechanical causes of knee replacement pain are important to consider. But to be honest with you, we still haven't talked about one of the most devastating causes of chronic pain after knee replacement, and that is infection. Most people think that infection is always obvious with a red, hot, swollen knee, but the truth is, it isn't. Some infections actually just show up with more subtle symptoms, like just pain. That's exactly why many surgeons recommend testing for infection even if it doesn't seem likely on the surface. And since chronic infections are harder to get rid of than more recent infections, it's always best to reach out to your surgical team if you're concerned about your symptoms. So far, we've talked about causes of pain away from the knee and causes of pain related to the implant itself. But there are causes of pain that sit outside the knee joint, but still in the knee area, and it's important to consider those too. For example, blood vessel conditions like peripheral artery disease can cause pain. This is where the artery gets narrowed because of plaque buildup, which causes pain because less oxygen is able to be delivered through the narrowed artery. Since these plaques are in the arteries, they're actually different than a deep vein thrombosis, which is what most people think of as a blood clot. Blood clots themselves can also cause pain in the knee area. They're more common early after surgery, but they can absolutely happen later as well. So if you're experiencing sudden leg swelling and pain, especially if you're having chest pain or shortness of breath, seek emergency evaluation right away to rule out a blood clot. And then there are the soft tissues around the knee. Just like how you can develop tendinitis or bursitis without ever having surgery, you can absolutely develop them after surgery too. Tendinitis is inflammation of a tendon, which is the structure that attaches a muscle to a bone. For example, the quadriceps tendon attaches the quadriceps muscle to the patella, and bursitis is inflammation of a bursa, which is a small fluid-filled sac that works like a cushion for the nearby joint. Both tendinitis and bursitis can cause pain around the knee that has nothing to do with the implant itself. But here's where it gets complicated. There's one more cause of pain we need to talk about. It amplifies the pain from everything we just covered, and it's one of the hardest for surgeons to diagnose. Imagine this. The x-rays look fine, there's no sign of infection, and the hip and spine have both been cleared. And yet the pain continues. This is actually more common than most people realize, and the research has given us a better idea of why this can happen. The answer is nociplastic pain. It's a bit of a mouthful, but the concept is straightforward. It's pain that comes from changes in how the nervous system itself processes pain signals. You already know about two other types of pain from this video. Nociceptive pain is pain from tissue damage, like the arthritis that led you to your knee replacement. And neuropathic pain is pain from nerve damage or irritation, like the radicular pain we talked about earlier. Nociplastic pain is the third category. It still isn't fully understood, but researchers have an idea as to how it happens. After months or years of dealing with pain, the spinal cord and brain can become more sensitive to pain signals. You can think of it like a volume knob that's been turned up. Normal sensations that shouldn't be painful get amplified into pain, and things that are already painful become even more painful. But here's what's really surprising. Studies show that as many as 40% of knee arthritis patients experience nociplastic pain to some degree without even having surgery. Most of these patients haven't been formally diagnosed with it, but the amplified pain process is still there, working quietly in the background. Now, here's why this is important for knee replacement patients. Research shows that patients with this kind of pain processing have less pain relief and worse functional outcomes even after knee replacement. One study found that even after knee replacement, the pain amplification was still there. Removing the arthritis didn't reset the volume knob. The important thing to know is that nociplastic pain is treatable, but it takes a different approach than the structural problems we've been talking about. Research supports targeted rehabilitation, psychological and pain coping strategies, and working with pain specialists. Let me be clear, none of that means that it's just in your head. It means that the nervous system has changed, and that change is just as real as any structural problem with the implant. But just like with every cause that we've covered, the first step is correctly identifying what's going on. I know we've covered a lot of ground in this video, so to help make sense of everything, let's do a quick recap. We covered sources of knee pain that are completely outside the knee, like hip and low back problems. We also covered implant-related problems like stiffness, malpositioning, instability, and infection. Next, we talked about problems near but outside the knee joint, like vascular disease, tendinitis, and bursitis. And lastly, we covered nociplastic pain. Look, pain after knee replacement is frustrating enough as is, and seeing all the different things that cause it can be overwhelming. But the first step to treatment is getting the right diagnosis. I hope by now you feel like you have a better understanding of what might be going on, and more importantly, that there are real answers out there. If you're recovering from knee replacement and you want to know my top 8 post-op exercises, I'll put my video on that right here. If you want me to talk more in depth about anything in this video, let me know in a comment below. Stay well, and I'll see you in the next video.